Welcome back. Today we'll be addressing Cubital Tunnel Syndrome. Cubital Tunnel Syndrome is a nerve entrapment syndrome at the elbow junction that affects the ulnar nerve and causes dysfunction of the ring and little finger, paresthesia, pins and needles, pain. And so what we want to do today is show you the muscles to stretch and the exercises in order to alleviate this condition. The stretch that is best to perform is taking your affected hand, taking your wrist, bending it backwards, an extension, rotating it inward, and really what you're doing here is not so much as the wrist junction. This is all a combination in order to affect the elbow. So I'm here extending it, rotating it in, while extending it again and pushing my elbow out and feeling for the stretch on the inside of the elbow. I'm going to hold that for a set of 10 to 15 seconds and perform it 3 times. And that is right here. I mean, really feel it stretch right there. So what you want to do, this decompresses the ulnar nerve at the elbow junction. So you want to perform that stretch before you do your exercises. Another basic stretch again is just your palm up stretch right here, which stretches the flexor group. You can do this elbow straight, bent, but helping decompress the elbow joint by lengthening the flexor group, because what happens is the muscles around the elbow joint become so tight and restrictive that it actually takes the joint and cocks it. Kind of, if this was your elbow joint, bends it slightly. So not only is the nerve being compressed here, but the elbow joint is bowed slightly, which causes dysfunction, and it does not ride right in the process. So what you need to do here again is perform that stretch and then follow it up with a few basic simple exercises. The exercises that we'll be performing with flexed end are the palm up isolated exercise, where I'm spreading my fingers, extending my wrist, and my elbow isn't moving. If your elbow is not bothering you that much, you can go ahead and do the palm up elbow moving. If it is bothering you, either do the isolated or move through the range of motion that's comfortable. The next exercise is the palm down isolated exercise. Extending my wrist and fingers, spreading my fingers apart, and performing the palm down isolated exercise. The next exercise is a radial deviation exercise. I'm kind of bringing the bands down by my elbow in a thumb up position, extending my wrist and fingers, spreading my fingers apart, and rotating the wrist up, cocking it upward. This is actually pretty hard. It seems like it's easy, but it's a small action right here at the end that really fatigues the radial deviators. These ones right here. So it stretches this group while strengthening this group. The next exercise is going to be the supination exercise, starting palm down, bands into the forearm, spreading my fingers apart, extending them, and rotating my wrist into the palm up position. Palm down, rotating, palm up. And making sure you're spreading your fingers apart and opening your hand as far as you can in the process. The next exercise, the last exercise, is going to be the thumb up exercise. And this is an isolated position as well. Band on the inside of the elbow, thumb up, and then of course if my elbow does not bother me, I can do full sweeping, full movements, thumb up, elbow moving, or I can go ahead and just move through a range of motion that's comfortable if it's not painful. It comes with an arm strap and longer bands, so it's easier to do those full elbow exercises. So perform these exercises and stretches, and you will find quick relief of this disorder. A lot of surgeons say you need to have surgery to reroute the nerve, which is absolutely ridiculous. Unless you are born with a physical anomaly where the nerve is in the incorrect place, then you would have this dysfunction right from the get-go while you were very young. That's not the case in most cases. What it is that it develops over time due to repetitive overuse, a lot of you working with your hands, and so the muscle group becomes really tight, thick, fibrotic, restrictive, and it compresses the ulnar nerve. And so the thing is, if it took time for the injury to develop, it can be taken away and removed over time by reversing the process. So again, I've seen a lot of people where we just do massage to the flexor group on the inside of the elbow here. We'll do a lot of motor point therapy and then follow it up with the stretches and exercises, and it's gone. So you can even do self-massage here on the inside of the elbow joint. Right below, here's the bone right here, the medial epicondyle. Go right down here in the groove, and the meat of your flexor group all the way through here. You can massage this, and if you do the massage first, then you massage, perform that elbow stretch that I showed, then follow it up with the exercises. And you will find quick relief from this condition. And you can go all the way to the inside here, because the muscle group is all the way around here. So that will help relieve compression of the ulnar nerve. So thank you for viewing this video. We will have some more videos coming soon, and we will also be doing a product comparison here in the future. So thanks again. Look forward to doing some more work with you.